show you some still photos, animations, illustrations, take you inside my OR, kind of walk you through seeing what I see in the OR. So greetings to everyone from Yale and the Yale School of Medicine. My disclosures are shown. I do some consulting work with DePuy and Thompson. Their products will be shown in this slides, but they had no influence on the talk itself. Very pleased to announce the next Anterior Hip book will be coming out AOS 2024, and that's going to be a great resource once again for this Anterior Hip community. So the goal is to get an exposure to the acetabulum that is able to see everything you want to see and put in any instrument you want to put in. So the question is, to get to this point, how do you get there? Let's go backwards. If we reverse engineer this, when I look at this acetabulum, this is the left tip, we're looking at the transverse ligament, which is in blue. So let's now strip away the soft tissues. Let's look at the pelvis itself and remove all the soft tissue anatomy. So let's go to the illustration here, and we're looking at the anterior and posterior aspect of the pelvis and the cotyledons. So this goes back to the transverse acetabular ligaments, and this goes way back to Henry Carter and Henry Gray. And so this is a confluence of the labrum that goes across the cotyloid fossa, and this is a really helpful landmark that's been studied well, and I'll show you some papers to illustrate the utility of this for the anterior hip. The surgical anatomy, we have the anterior and posterior cotyledon. The goal is to get exposure of those. Now, historically, on the left side, this is what the historical retractor use was, anterior brim and lateral rim. And so this allowed you to see what you had to see, but I really couldn't see well the medial side of the pelvis. And so what I've tried to do is update that strategy to include identification and preservation of the transverse acetabular ligament, and I'll show you how I get there. So the concept here is exposure before instrumentation. If you get the exposure, you can put anything in. It's agnostic to implant choice, and you can use any implants on the market. So we can put the reamer in, we can preserve the TAL, we can see the rims anteriorly and posteriorly.